Hello everybody, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Healius Cancer Clinic. So I would like to take this opportunity to discuss a fairly controversial topic about early prostate cancer. Which is the best treatment for early prostate cancer? Early prostate cancer means that the cancer is just confined to the prostate. Most of the time, this is detected by screening, and there are actually three treatments for this. One is not to do anything, just actively follow up the patient and then see whether this patient needs treatment. That is one thing. But the more controversial thing is whether surgery is a more effective treatment for early prostate cancer or radiation. Now, the controversy has arisen because both these treatments have got their pros and cons. Let me go a little bit in more detail. Which is the more effective treatment? By surgery, we mean usually it is removal of the prostate, a procedure known as radical prostatectomy. Now, more and more, this surgery is done by the minimal invasive way, by robotic method, where the surgery can be done with high precision, with very minimal damage to the surrounding structures. The requirement for blood or the chances of complications in this type of surgery has come down a great deal. Radiation too has evolved over the last 10 to 15 years with more precise methods of radiation delivery. The first aspect which we need to consider is which is a more effective treatment. Now, if you see the cure rates and the local control rates, it is almost neck to neck, where both surgery and radiation have got very similar cure rates. And this one, maybe if you see in terms of evidence, surgery scores marginally in this area. So the decision can't be based on cure rates alone. So then what do you base your decision on? So if the cure rates are similar, the next thing which you need to consider is which has got less side effects. Now then you need to know what are the possible side effects. The first side effect which you need to know is incontinence. Sometimes after treatment, the person may not have full control over the urine, and the urine may dribble out without control, especially if the person is doing something strenuous like laughing. So if you compare surgery and radiation, surgery has got, even in the best of centers, has got a little higher incidence of incontinence as compared to radiation. Because in surgery you are actually handling the muscles and nerves which are responsible for the continence of urine. This is one aspect. The next aspect is sexual function. This again is related to the nerves which are very close to the prostate. The preservation of nerves by surgery now is much better because you can actually see the nerves through magnification and preserve them. The chances of what happens that though the immediate chances of some problems with these nerves is higher with the surgery, over time it has been seen that the sexual preservation is somewhat better with surgery. The third point to be considered is problems with the nearby organs, especially the rectum. Here, since the radiation is delivered through the surrounding tissue or through the rectum, the chances of problems in the rectum is somewhat higher with radiation as compared to surgery. The thing to be aware of is the chances of second malignancy, especially in patients who have undergone radiation. If you do it in a young patient, though the incidence is small, there is a small possibility that the patient may turn up with a second malignancy, say after 10 to 15 years because of the radiation. So though there is no clear-cut winner, there is a slight bias towards surgery, since it scores better on most of the fronts. The other point which you need to consider is the availability of technology which is in the place where you intend to take treatment. If the newer advanced methods are not available, then for both surgery and for radiation, the chances of problems will go up for this. So that factor also needs to be consideration, where you intend to take the treatment and how experienced your training oncologist is. This also influences the treatment. So there is very little to differentiate between surgery and radiation in early prostate cancer, and the decision will have to be taken in discussion with the treating oncologist depending on your priorities. Thank you.